We're going to get started with some really good news that we have been seeing over the last few months with COVID, and that is the reduction in our hospitalization rates. And we're joined by representatives from 3 of our local hospitals today, and I'm not yet seeing Dr. Blum on the call, but we do have Dr. Mahendra Pudel, who is the infectious disease specialist at Salinas Valley Memorial Healthcare System. And Dr. Pudel, I'm hoping you might start us off maybe with some information about the Delta variant that has been a concern for people.
Sure. Right now, it's great that we don't have any patients at our hospital in Salinas with COVID. At one point, we had over 100 patients, and our floors were filled with these patients. We're struggling to find resources, manpower, nurses, ventilators, and with mitigation measures, including masking, distancing, and vaccines that are very effective, we are where we are right now. So it's great news. It feels like the pandemic is ending. And the recent hospitalizations that we had over the last several weeks to months and death were predominantly in unvaccinated patients. So good news is these vaccines work extremely well against COVID-19. But there are several threats that we are seeing to end this pandemic. And I see specifically 2 very concerning points. One is these new variants, specifically Delta variant, and still a significant amount of population which are unvaccinated. Just wanted to talk a little bit about this Delta variant, which is gaining a lot of traction throughout the world. It was initially detected in India. It appears to be highly infectious, 60 to 70% more infectious than some of the other variants. And there are increasing concern that it may cause more severe infections in vulnerable population. What we've seen recently, both internationally as well as within the United States, is there are cases rising at an alarming rate. The most recent data shows that the Delta variant accounts for about 20% or more of the cases within the United States. And these are specifically seen at a very high rate in the population and states that have low vaccination rates. And with travel during summer and schools opening in fall, we are really worried that we're going to see increasing number of cases, especially with Delta variant. The good news is the vaccines that we have, specifically the mRNA vaccines, including Pfizer and Moderna, seem to work extremely well against all of those variants, including the Delta. So it's really important right now more than ever to make sure you are vaccinated, to protect yourself, to protect your family and your community. So, we really are hoping that our community gets vaccinated and builds that wall of protection so that we can keep our community safe.
Thank you very much, Dr. Patel. And now we have Dr. Martha Blum from Community Hospital of Monterey Peninsula. Hello, good afternoon.
Hello.
I'm wondering, can you tell us a little bit what's happening with COVID at the hospital? The numbers are so low and we're so encouraged. What is Dr. Patel mentioned it, the relationship between vaccination and these numbers that we're seeing?
Great, thank you for having me today. And indeed, what we see is that the vaccines are working. They're working very well. And, they're having absolutely the effect that we had all hoped that they would have, which is by decreasing the number of infections and decreasing the number of severe cases needing hospitalizations. In the last week, we have seen only anywhere from 1 to 3 patients hospitalized in our county. So that's 1 to 3 patients in the whole county. So that's really great. At Community Hospital, we discharged our last COVID patient on the 6th of June. So it's been 2.5, almost 3 weeks since we've had any COVID cases at Community Hospital. In the last 30 days at community hospital, we've had just 5 COVID admissions, just 3 COVID admissions, and only 5 positive COVID tests out of all the tests we've done in the last 30 days. So vaccinations are really working, and they're working very well. And as Dr. Pudell pointed out, the vaccines also protect against these variants, these mutant forms of the virus that we are very concerned are very transmissible, very contagious, but the vaccines work and they will protect against being infected with those viruses as well. So we do want everyone out there to take full advantage of the vaccines. They're working, they're safe and effective for everyone ages 12 and up. They're abundant. I would particularly encourage young people who may not think that this is a big priority for them to go out and get vaccinated. It'll make a big difference for when you're returning to school, you know, people who are college age. This is going to be a real boost to being able to be out there with friends, gathering in large groups, being able to go indoors and enjoy indoor activities without the need of additional precautions such as masking or physical distancing. So I think right now we're at a spot where everyone is definitely enjoying the benefits of those large numbers of people who've already been vaccinated, but we want everyone to join that group and enjoy those benefits of protection, as well as, you know, expanding that bubble of protection to those who are not yet eligible to be vaccinated, meaning children, school-age children who are younger than 12, as well as for additional protection of those people who may have conditions that compromise their immune system, so they may not be as fully protected by the vaccine as others. So I do want to end on another note of caution. So as good as the situation is right now, with the number of hospitalizations being at an all-time low and near zero, and the cases being in single digits really for the last week for the whole county, that's such a great place to be right now. You know, on the other side, we have seen a very small number of breakthrough infections, which are infections in people who are fully vaccinated. So as great as the vaccines are, they are not 100%. So anyone, even if you're vaccinated, anyone who has symptoms suggestive of COVID-19 with a fever, a cough, a sore throat, those kinds of things, take those symptoms seriously, because it can still happen that the virus is still in our community, it's still circulating, and vaccine protection is not 100%. So anyone with symptoms still needs to be tested and still needs to take that seriously to prevent the ongoing spread in our community. And lastly, I want to say that it's been really great for all of our businesses and our communities that people can now take the mask off in a large number of places where they were mandated to wear it before. But in our healthcare facilities, our patients, our visitors, and all of our staff and medical staff members are still wearing masks. So if you do have to present to a medical facility for care or to visit someone, please be aware that the masking mandate is still in place for healthcare facilities. But other than that, I hope everyone's out there enjoying the summer.
And hopefully with that perfect summer accessory, a vaccination, right?
Exactly.
And then we're also very pleased to be joined by Dr. Craig Walls, who's the Chief Medical Officer at Natividad. We'll wrap up this trio of good news with Dr. Walls. Tell us a little bit about what is happening at Natividad. And also, I'm wondering if you could touch on testing that Dr. Blum was mentioning. Testing seems to have, fallen off. Everyone's very focused on vaccine, but testing seems still also to be very important.
Absolutely. And thank you for the opportunity to talk to the group today. Wonderful to share this space with these illustrious colleagues who are infectious disease specialists, which I am not, so certainly defer to their greater expertise. Natividad is seeing the same pattern. Unfortunately, we do have one patient in the hospital today. We also track how many recovered patients we are taking care of, and we have no recovered patients, which is good. That means folks have gotten better and then discharged. I think for the rest of our careers, we're going to be, certainly the three of us are going to be cautiously optimistic after having seen what we've seen over the past 18 months. I think we need to remain vigilant in certain ways. Testing is absolutely one of them, Maya, and I'm glad you brought that up. We do need to keep our foot on the gas with testing, and certainly anyone that's experiencing any symptoms should get a test. That's going to be really important to staying in the good place that we're in today. As far as vaccines, I'm very happy and proud to report that my two children that are over the age of 12 are fully vaccinated now. And, with just minimal symptoms, 24 hours after their shots, which actually bought them some extra TV time and ginger ale. So I think on balance, they probably came out ahead. But it's a great feeling. I think if you have not yet become fully vaccinated, or if you have family members that have not who are eligible, I think you'll be surprised at how good it feels to know that you have this outstanding protection, really remarkable protection. And I think the vaccines are responsible for our low numbers. But it's very possible that in time we'll learn that we need boosters to keep our immune status up. And we may also need boosters for these new variants, such as the Delta variant, although the Delta variant seems very well covered by the inoculations we have now. So I'll stop talking, but really a happy call today after lots of different kind of calls over the past 18 or so months. So pleasure to be with you today, and thanks for the opportunity.
Thank you very much. And if you, all three of you, if you could stay on the line in case we have some questions after our other presenters, I would sure appreciate it. And I'm really glad to hear that your kids got some extra TV time for their shot. And I don't know if anyone else had the same feeling, but once you're fully vaccinated, there's an incredible feeling of relief. It's hard to describe, but thank you. And so now we're going to move on to some other good news about reopening, and that is reopening of one of our beloved local parks, San Lorenzo Park in King City. And we're joined by Nate Merkel, who's the Administrative Operations Manager of Monterey County Parks. And he's going to give us a lowdown on San Lorenzo Park that is going to reopen for all those who love it.
Good afternoon, and thank you. We will be opening San Lorenzo Park to day use guests starting July 1st. The campground, unfortunately, will remain closed for the time being until we have further direction from the board. And the other note is that the Board of Supervisors voted to remove or waive day use fees for our day use parks in Monterey County, including San Lorenzo Park, for this fiscal year. So from July 1st to June 30th, all of our guests are able to access the park for free. The day use sections, and camping and some of the group sites will have a fee associated with it still. All the reservable group sites will still have reservations and fees associated, but the day use sections will be free to all guests, and we will be opening the De Anza building as well for reservations and group sites. The other note is that the museums section will also be opening on a limited basis. The main exhibit hall will be open July 1st. The schoolhouse will be open as well. For tours and school groups and things of that nature. A few of the buildings will remain closed while some repairs are underway and some staffing issues are worked out. But we really look forward to having everybody back.
All right, thanks very much, Nate. Great news. And if you could stay on the call for after our presenters for any questions. And now we're going to keep on the theme of reopening, and we're going to turn to businesses. A lot of businesses have had questions about California's reopening, and this is where Kim Stemler comes in. She has been working on a webinar to help businesses answer questions about the new rules for reopening. Kim, tell us about the webinar.
Thank you, Maya, and thank you, doctors, for everything you have done in your hospitals. You are greatly appreciated. Please know that. So yesterday, actually, the Monterey County COVID Collaborative, facilitated by the Community Foundation for Monterey County, hosted a webinar with Cal OSHA and with a representative from TPO, Human Resource Management, Melissa Irwin, who was amazing. And that webinar is still available. We're getting excellent reviews, 5 stars on this webinar. So we highly recommend it. There are lots of questions that businesses have, rightly so, about are you able to verify the vaccination status of your employees? Are you able to have them come into work? What about masking? Who has to wear a mask? Who doesn't? There are so many questions. And this webinar answers a lot of them. They can all be found at, and I'll put this in the chat, at MontereyCountyVaccines.com, the webinar and the associated resources. At that website, there are also signage templates that you can, as a business, you can just download and put on your door. Pick the one you like, download and put on your door. Again, on that website, we have a list of all of the individual vaccine clinics in the county. There are over 80 a week. To make it easy, in addition to the list, and the list is done by region, we have also prepared flyers by region. So if for some reason your organization would like to share with its constituents, you can just download one of the weekly flyers by region. And then along with vaccines, if anyone has a group of people, say 10 to 20 or more, be it a business, be it a social club, be it just somebody in the neighborhood that's very connected and can bring together 10 to 20 people, please reach out to me. And again, I'll put my contact information in the chat. We can arrange for vaccines to come to you. So we will figure it out. We can't allow anyone in this county that wants to get vaccinated to not be vaccinated. And then that is also true with testing. In addition to wonderful partnership we have with the state and the Optum sites, there are private testing sites going on. And then also we have over 100 community-based health workers now trained in testing. So testing is available, vaccines are available, information is available. And for businesses, we now have some coaching for you available from Cal OSHA and TPO. Thank you very much.
All right, thanks very much, Kim, for filling us in on that. And then for the last thing, it falls on me. Many of you may have gotten information today about changes in our county facilities policies on mask wearing with reopening. And I'm going to go ahead and share my screen here and just kind of walk through this a little bit with you. I'm going to move this around. So many of you got the information release on face covering requirements for our county facilities. And I'm going to run through, it looks a little busy here, but basically no face covering is going to, and this begins tomorrow on Thursday, the 24th. No face covering will be required in any county facility for those people who are fully vaccinated. And we're going to be accomplishing that by asking members of the public their vaccination status at buildings where security or staff is present at the door. So if you're coming to a county facility and there's staff at the door, they will simply ask you if you're fully vaccinated. If you are not fully vaccinated or you don't wish to say, you'll be asked to wear a face covering. If you're at a county building where there is no personnel available, we will simply assume that if you are wearing a mask, you are not vaccinated. And if you're not wearing a mask, you are fully vaccinated. If you are wearing a mask, you need to wear one because you're not vaccinated. Additionally, members of the public who come to a county facility for a one-on-one meeting with county staff could be asked their vaccination staff by that county employee who is providing the service. And you may be asked to wear a mask for the time that you're engaging with that employee if you are not vaccinated or if you decline to indicate your vaccination status. We're trying to keep everyone safe. And I thought you might also like to know for county employees what they're doing to help keep the workplace safe. For county employees, no face covering is required if you are fully vaccinated, and our county employees must provide proof of their vaccination status in order to not wear a mask in a county building. And employees are still going to go through daily self-screening for COVID-19. And unvaccinated employees or those who decline to provide their vaccination status are going to be required to wear a face covering indoors, and for instance, if they're in a vehicle with other employees. Additionally, employees may ask the vaccination status of a member of the public who's requesting a one-on-one meeting and ask them to wear a mask if they are not vaccinated or if they decline to answer. So that is just a rundown of what people can expect when they come to a county facility beginning tomorrow. This is a good compromise and a way to keep everyone safe as we're all doing business together. And so that is all the presentations for right now. And we're going to go ahead and start with some questions. The first question is for Dr. Pudell. Could you confirm the information that no Delta variant has been detected yet in samples from Monterey County?
Yes, that is absolutely true. As of yesterday, we're in the Monterey County meeting, and as of now, there have been no cases of Delta variant in our county yet. But there have been cases of Delta variant in the state of California. Fortunately, our lab at the county is capable of doing sequencing, and they are regularly sequencing the tests that get sent to them. And as of yesterday, we are required to send all positive testing, be it in the emergency or hospitalization, so that they have enough sample to be sequenced. So this is great that we're collaborating with the public health lab and the local hospitals and healthcare facilities. Although we don't have cases of Delta variant right now, doesn't mean we're not going to see those cases, especially down the road in pockets of unvaccinated population. And we should know if we will keep you informed if we see any of those cases here in the county.
I'll just
Thank you,
add on to
Yeah,
that.
please do.
The dominant circulating strain is the Alpha variant, the one that people may be familiar of as the UK variant. And that one is also more transmissible than the coronavirus that had been circulating previously. So we do have a variant here in the county that is the dominant circulating strain, and it is more highly transmissible and contagious than former versions of the virus. So still plenty enough to be concerned about.
All right, thank you both. And more questions coming in. I think this is for all of us. I'm going to throw this out to all of the doctors. Dr. Fauci is quoted as saying he is concerned about the transmissibility of the Delta variant among children. Is this a concern among any of our health officials as more summer camps are opening and as families travel to and from Monterey County as summer goes along?
Yeah, I can chip in. Definitely, it is a concern, especially in young adults who have not been vaccinated. And we know the Delta variant is highly infectious. It's 60% infectious than the UK variant or the Alpha variant, which is probably 50 to 60% infectious than the original variant. So, the percentage just tells you how infectious it is, and especially if it can penetrate those populations that have not been vaccinated, it is of a real concern. Fortunately, we don't have the variant, or we have not detected in our county. And as long as the people around the kids have been vaccinated, it builds a great wall of protection, so that the kids don't become infected. So, these are things that are of concern, especially opening schools, camps, and travel. But, as long as the parents are vaccinated and the unvaccinated or the vulnerable people continue to practice social distancing and masking, I think that's the best you can do right at this moment.
And I just wanted, after listening to Dr. Pudell, throw this out to the rest of you. Is this something parents who may be hesitant for whatever reason, this sounds like a really good reason to get vaccinated because of the children that may be in your household.
Agreed. I would just point out that, yeah, the vaccines work really well, but when you have pockets of unvaccinated individuals where you have, many people who are unvaccinated interacting together regularly. So think of an elementary school, because those children are all under the age of 12. None of them are eligible to be vaccinated. So yes, when you think of having a situation where you're going to have gatherings of significant numbers of unvaccinated people, that's exactly the type of situation where we do get concerned that the virus could be introduced there quite easily and could spread easily in a setting like that. But yeah, the best thing we can do until those children are eligible for vaccination is to have as many people around them vaccinated, so there's not really any sort of opportunity for the virus to get into that population. So in that situation, and in summer camps, like you were mentioning, hopefully summer camps will largely be held outdoors, which is great for the kids and also really great for minimizing the risk of transmission of this virus or any other contagion for that matter. So, hopefully the fact that most of those summer camps will be outdoors and the kids can easily be physically distanced from one another, or continuing to use face masks and face coverings for unvaccinated children if they are spending large amounts of time indoors in a summer camp setting or a school setting. That's going to be kind of the recommendation, and that's still the recommendation from California Department of Public Health for at least this near summertime period until they can get vaccinated. And absolutely, middle school age, high school age, college age, all of those people are eligible for vaccination right now. And I can't think of a better reason, if you're still looking for a reason, but being able to be back in the classroom with friends and colleagues, fully vaccinated and not having to mask would be, for a lot of college students who had a very unusual year at college last year, I think that the thought that they could have a more normal college experience next year might be a big motivating factor.
All right, thank you for that. I have one of those college students who spent his college year at home. Another question. Are you guys able to share exactly how many hospitalizations, COVID hospitalizations, are at each of your hospitals? Me Memorial did indicate that while they couldn't attend the briefing today, they did not have any hospitalizations at Me Memorial.
So at Salinas Valley Memorial Hospital, we don't have any active patients or COVID recovered patients, which is great. This feels, very good compared to where we were, a few months or a year ago. But we're constantly, testing anybody that comes in with symptoms suggestive of COVID. And all the patients that are being admitted to our hospitals are still being tested for COVID.
And I think,
Right.
Dr. Blum, you mentioned that you had
Right.
none.
Yeah, community hospital, we have no COVID patients and we have no recovering COVID patients. Our last COVID patient left the hospital on June 5th, but just like at Salinas Valley, we're doing an awful lot of testing and surveillance testing, hundreds of tests in the last month, and only 5 in the last 30 days were positive here.
And then Dr. Walls, I believe you said you had one.
Yes, ma'am. One active and no recovered.
All right, thank you.
And can I just add one thing real quick?
Yes, please do.
For the last about 2 months, all of the patients that have been hospitalized, gotten on the ventilator, or died at our facility have all been unvaccinated patients. So I think that's a great message to send, that if you're vaccinated, you are very well protected.
Very sobering. One other question for the three of you. If we see a spread of the Delta variant among children under the age of 12, especially when the fall semesters come around, would you recommend switching back to distance learning? Frankly, what would your recommendations be should we have an outbreak that affect children under 12?
Yeah, I'll get started and maybe Dr. Blum and Dr. Walls can chip in. So we're really hoping that doesn't happen, right? That's why it's really important to get your vaccination rate as high as possible so that the virus cannot, multiply and penetrate through the community, especially in the kids if they're not been vaccinated. We are hoping by the end of the year or early, winter that kids 6 to 12 will be eligible for vaccination. I think they're looking at some of the data and see if they can have an emergency use authorization of vaccines for the younger kids. If that happens, then it would be great so that we can vaccinate those kids 6 to 12. And I think how we've seen this again and again, how we behave, what type of activity we do. We're not deciding recently. It's the virus that's been deciding what we're going to, what we can do and what we cannot do. And there's, depending upon what percentage of virus circulates, how much hospitalization we see, we may have to put in strict mitigation measures, especially back to masking again, distancing, distance learning. We don't know at this point what's going to happen, but we're really hoping with vaccination rates going up that we don't have to revert back to social, distance learning, because my two kids, I'm not sure how fruitful last year was with distance learning, and they're really glad that they can be back at school. So, I'm hoping, we don't have to go back and we can continue in-person learning.
Dr. Walls, Dr. Blum, do you want to add anything to that?
Yeah,
Nope.
It's very difficult to predict what's going to happen, but there are, a few certainties of what we do know, which is that, again, getting as many people that are currently eligible to be vaccinated, to get them vaccinated, will certainly prevent this Delta variant from getting much of a foothold in our county at all. So we'll just kind of have to wait and see what unfolds. We have a whole toolbox of things that we can do to really mitigate the spread of the virus in our county. And again, we can draw on each of those different tools as needed as the situation unfolds. But right now, the best tool we have is really getting everybody vaccinated.
We'll try to wrestle control over the virus, away from the virus and to us, right?
That's exactly right.
Right. All right, that is all the questions that we have today. Thanks everyone for being on the call today. Really great information. Thanks for sharing. Our next media briefing will be next Wednesday, and we'll see you then. Good afternoon, everyone.
Thank you.
Thanks, Maya.